Welcome to our podcast. My name is Maria Lloyd. I am a licensed marriage and family therapist, and I'm here with Justin Yanuck, who is an emergency medical physician and also runs a local IV ketamine clinic called Renew in San Juan Capistrano. And I work here in Mission Viejo. We're both in California. And our desire is to share our passion to educate people around what ketamine is, psychedelics in general, but we're focusing on the one that's legal right now, which is ketamine. And we're calling this Catalyst for Healing because this is not a quick fix and this is not something you do once and your life is better forever. And we want to explain those complexities of that and that what ketamine actually is catalyst for the growth and change that you can make in your life. And so why
Yeah,
don't you introduce yourself,
sure.
Justin? Yeah.
Cool. We did the intro. Yay. My name's Justin Yanuck. I am a physician. I did my training in emergency medicine, largely because throughout med school, I just liked everything and couldn't decide what I wanted to do. And it turns out with emergency medicine, you get to do everything. I did a fellowship in pain medicine. I started working in a chronic pain practice and in the emergency room right around the time that COVID started. Um, and I kind of was simultaneously faced with these two epidemics. There was the COVID pandemic that was going on, and then there was this chronic pain and mental health pandemic that was going on. And for me, it just became abundantly clear in both of those spaces that there was a pretty significant subset of patients that we weren't helping, and I didn't really have the tools to help them. And so in my chronic pain clinic, I kept, I had all these fancy tools, all these interventional procedures, spinal cord stimulators, and intrathecal pumps and epidurals, and there was just patients that I couldn't help. And the same thing in the ER. There was these patients with mental health issues that were on all these medicines, and yet we're still coming to the ER with suicide attempts or severe depression and things like that. And kind of everything came to a head when I started to read about psychedelics and the promise that these medicines can have for patients with more just existential suffering. And one thing led to another, and I started to incorporate these medicines into my practice in the pain clinic. And then I was like, maybe I should create my own space where I can offer this to all sorts of people that the kind of current medical system is not helping. Why don't you introduce yourself?
Okay. Well, I have been a licensed marriage and family therapist. I got licensed in 2001, so it's about 23 years, and have always been very passionate about healing people, and particularly got into, as many therapists do, they start to specialize in the areas that they struggle with. So I have struggled with chronic depression for years, and that became kind of my area of specialty was depression. And then as language grew around highly sensitive people and empathic people, I started finding that often the most severely depressed people are very sensitive, very empathic, and also have the chronic health issues combined. So I was working with very hard to treat clinical depression clients, and through my own healing journey, because I was also at a low point when the pandemic hit. I was in perimenopause, and I was desperate to find some new tools. And I was feeling really stuck with clients, which made me feel really burnt out. And so it was at that point, which was only 3 years ago, where I thought there has to be something new. And I just started researching and had learned about ketamine. And I was frankly terrified to try it. But at the same time, when you're depressed, there's kind of I'll try anything experience that you get into to feel better. And so I went through my own treatment, and I'll share in other episodes how that went because I've used different modalities and we'll explain at other episodes too that there's different routes of administration. But what I found was mine did not include psychotherapy. And after I was going through the treatments, I realized the essential component of that in order to really heal not only root of the trauma, but to make some behavior changes. Because the catalyst of the ketamine is like you finally feel good again, but that's going to fade. So if you don't make those changes in the relationships you're in, maybe even your work life, exercise, healthy nutrition, it's not going to sustain. And so that's when I started training 2 years ago to be a ketamine assisted psychotherapist. And now I'm more passionate about this than ever because I've seen it help me, I've seen it help my clients. And Justin and I happened to meet, what about 6 months ago, maybe?
Yeah, maybe, yeah, right around then. Yeah, our ketamine clinics are an interesting space, and I'm really excited about where the future of psychedelics are going. And there's so much that we have to talk about,
Yeah.
the business side of psychedelics, but also kind of where they're growing and the research and all this stuff. But to kind of focus on my ketamine clinic, I work with my partner, Dr. Tanya Dahl, and we created a really small, intimate clinic down here in SoCal. And one of the first things we had to decide is, do we want to incorporate psychotherapy into our practice or just encourage patients to utilize psychotherapy as part of it? And I think the easy decision would have been to just, well, if you want to do psychotherapy, do it, but we're not going to like require it or mandate it. But I think acknowledging the importance of psychotherapy as critical to extracting the most benefit from psychedelics,
Yeah.
Was kind of the cornerstone of why I got interested in this space and what I truly feel to be the most powerful and useful way to get the most benefit from this space. It was just a non-starter for us. So we started with psychotherapy is going to be integrated into our practice. We were starting to look around for psychotherapists that are familiar with this space because there's not a lot,
Yeah.
like very few. In fact, I routinely speak to therapists who have never, not only have they maybe not heard of it, but they have no experience working
Right.
with it. And so it was really natural when we met as like an obvious partnership. Like,
Yeah.
you're interested in this space, you have experience in this space.
Right.
Let's
Well,
let's
and
part
what
ways.
was amazing was that I was using ketamine in the sublingual form in my office with clients, and that was really helping them work through trauma. But you get about 30% bioavailability, and so I knew they needed the IV because they were severely depressed. And so when I met Justin and Tanya, I was like so impressed with them having incorporated that already. And so we've just been, I think, excited to make the most of that blend because both are so critical,
Yeah.
to get the most out of the medicine.
Yeah,
Right.
it's worked well.
Yeah.
Okay, so we both obviously like each other and we respect each other. Great. But let's talk about ketamine. So ketamine is currently really the primary psychedelic, although there is controversy if we should use that word, but I think it's a psychedelic. That is that we're allowed to use basically for various medical purposes. Currently, we're using it for mental health purposes and for chronic pain purposes. Mental health purposes are things like treatment-resistant depression, anxiety,
Yeah.
OCD, PTSD, and then from a pain perspective, it's neuropathic pain, things like trigeminal neuralgia, severe burning pain in the legs, sciatica, things like that, complex regional pain syndrome, or just really treatment refractory pain. And I will get into way more detail about that side of things in future episodes. But ketamine is a medicine that acts on the brain to basically open up the various parts of the brain so that they can talk to each other again.
Yeah.
And why I think that's so critical to understand is because what you do with those changes is really contingent on what you put into it, and that puts a lot of pressure on the patient. But that's really where the psychotherapy comes into play, because just because we've opened you up doesn't mean you are going to form good habits. If your entire life up until that point has been maybe not the best of habits or the best decisions, if you don't have someone that you can talk to about process of things that you felt during the infusion, things that opened up, and ways to act on it in the future, you're probably not going to get long-term benefit from it. So maybe can you talk to a little bit about like what is integration? Like, what does that word mean, and how do you do that with clients?
So there's different ways to do it. With the ketamine assisted psychotherapy, and that's when I was doing it in my office, I'm working with people throughout so basically with ketamine, there's about a 40-minute dissociation. And when we get into more psychedelics down the road, they're like 6 to 8 hours with MDMA, psilocybin.
Yeah.
But so it's a good amount of time, because I think that's less intimidating for people to commit to, is to try, in terms of trying it. But there's a couple different components to it. So one is the preparation, which for me is I always focus on where the client is in that moment, like what is it that's coming up in the moment, and then whatever that struggle is, to think about what is it that you want to feel, and we go in with that intention. So like if they're really stressed out about this thing, we'll go in with peace, and we can do some meditations around that and focus on that throughout the journey. And so what happens in that dissociative space, and I have explained this to clients beforehand, this is where it moves beyond what you can even access in talk therapy. And this is where you, during that experience, you kind of get that ability to look back, because you're seeing a dreamlike state, kind of like images, pictures. Some people see colors, some don't. And so you're kind of getting that zoom out where you can look back and see things from a third party perspective. And we can't do that as humans just in the day to day, right? Because a lot of our trauma lives in our body. So our nervous system gets stuck in that state. So to even zoom out and see what it was that happened in the past that's holding us back, is very difficult to do. So I would say, like, one of the biggest things I'm seeing with clients is the majority of people with depression, I mean, all probably feel like there's something wrong with them, feel like I'm bad. And often this vision will give them and show them life experiences that happened to them that made them feel that way. And they can come out of the ketamine session and realize they were never bad. They're a human being. You know, they deserve love and respect. And that shift in like the self worth is so profound that they hold that. And this is kind of what I'm talking about, is with these clients that have been stuck for years because they feel so bad about themselves. That little shift can change their entire trajectory.
Yeah.
Changes how they show up with friendships or trying new things or just living life. And so, so there's three components: the preparation, then what happens during the session, and kind of helping people. Another piece is they might want to go back and reparent parts of themselves that were injured. But then it's the integration after the session that's really critical. And we have increased neuroplasticity for, is it 3 days, is what the research is saying. And so during those 3 days is when it's really important to start new behaviors. So I've always encouraged my clients to get, most important thing for mental health is sleep. And we know that so clearly now, to get a sleep routine in place, to work on healthy eating, to get exercise in place, because those three components make such a difference with mental health, right? Yeah. And so get those set up in that 3 days, because the neuroplasticity means basically it's more flexible and you'll be able to maintain those changes. And let's do some processing on what you experienced to get at those root causes of why you feel a certain way. And so that's, you know, the beauty of doing it with the actual infusion. Yes, people are going to feel great getting their 6 infusions within 3 weeks, but is that going to last without doing the deeper work, without doing the integration? I mean, we're seeing that it's not, right?
Yeah, I mean, I think there are rare cases where it can be. I think those tend to be the more mild cases, which, you know, that's great, but we just don't see a lot of mild cases. Most of the patients that come to our space have tried and failed everything, like really everything.
Yes.
And so I think you touched on a word I want to expand on a little bit, which was neuroplasticity. And it's such a buzzword in this space. If you're integrating the space, you've surely heard this word.
Yeah.
And I think it's a big word for a pretty small concept, which is basically just like opening up the connections in the brain. Ketamine acts on a receptor called the NMDA receptor. It acts on a lot of receptors, but one of the primary mechanisms of action that people think is how it works is that it blocks the NMDA receptor, and the downstream chemical reactions that happen are they lead to the synthesis of these proteins that can allow for new neural connections. We used to think you were born with the neural connections you have, and that's it. And really, over the last few decades, we've shown that there's actually a lot of plasticity and neurogenesis that can happen. And so we see patients, I mean, we've worked with many 70-plus-year-olds.
I know. They've been the most amazing.
And those people
Oh
understandably feel like I am who I am and I can't be changed. And that's absolutely not the truth.
No.
The mind is so moldable and malleable. And these medicines, rather than just providing you with a band-aid of like, here's a little bit more serotonin for a couple hours, or here's a little bit more dopamine for a couple hours, they actually work to change the underlying framework of the brain, and then allow for the therapy side of things to kind of help you work through it so that you can, one, process why you are the way that you are, like what life events led you to be who you are, how are you just hardwired at baseline, and then most importantly, like what are the steps you can take in your day-to-day life to live the life that you want to live, right? And so it's why it's like such a natural integration for the two sides of things to both get the medicine and the therapy.
Right. I was just thinking of, I don't know if he's 75. We had a patient that we were working with that felt like his life was just starting and wishing he had more time because the changes were so profound. And that was just, I don't know, it was really touching.
Yeah, no, absolutely. I mean, it's really rewarding. And there's so much interesting research in the psychedelic space, especially when it comes to even just end of life, right?
Yes.
With psilocybin, some incredible studies, and MDMA, where we're working with hospice patients and palliative patients, kind of processing their mortality. And what I love about that is it kind of gets to like the core issue of human consciousness is that we all are going to die, and we all know that.
Yeah.
And yet we still wake up every day and like pretend to have
not
like,
happening.
that's not going to happen, right? And so like, I think the beauty in those studies is it shows people that are imminently faced with that understanding and that they can overcome that, right? And so I think the beauty is like if those people can find purpose and meaning in the last few days, weeks of their life, surely us who have, you know, a seemingly infinite amount of days in front of us can overcome the struggles of our day-to-day life and find meaning and purpose. And that's really what it's all about, right? Ketamine is not, and psychedelics as a whole, are not happy pills or happy medicine, right? Maybe expand on that a little bit more, because that's something we get a lot. Is like
exactly. Well, and it's a concern that we both share is, you know, similar to marijuana once it was legalized. Like use this for everything, and you can buy it everywhere, and so that of course leads to misuse and abuse situations. But like I mentioned, I mean, the brain benefits are incredible. I will say that, and I can remember. My husband was driving me to my treatments, and after one of the treatments, I just started singing at the top of my lungs as we were driving home, and I looked over and he was crying because he hadn't seen that part of me, you know, come out for so long, and it was, you know, it really was profound. It was like when you're in a depression, you do, and it's immediate, like the day of kind of a thing, which of course you don't experience with antidepressants. That takes weeks and trial and error. So, I mean, that was incredible. But again, if I wasn't making some of the changes that I needed to in my life, those feelings would go away, and I need to keep getting more, you know, treatments. Now, you know, I don't know how you feel about the genetic piece with depression, but I do think there's a genetic set point. I mean, like similar to weight, I think of it. It's like some people have to starve themselves, and their body's never going to be as thin as that person that can eat anything, and it's just not fair. And I think there is that with depression where it's like we all have kind of a set point, and my set point is, you know, pretty low, and so we've seen with patients and trying to determine they do sometimes need the ongoing treatments just because of that set point. But so there's no black and white with this field, and I think that's what we were excited to communicate is there's so much complexity in figuring out what's going to work for you. But this whole idea of a pill every day, and now ketamine is being some have prescribed online that we have found that prescribe it to be used every day is not the purpose of how it's supposed to be used.
Yeah, we will surely expand on that in the future. But yeah, I think big picture, kind of philosophically, the idea behind these medicines are not to show you that you are an object that's broken and you need this to survive, but it's really to like give the individual the self-awareness and ability to understand that I can actually heal myself, right? And these medicines catalyze that change. but really, I mean, we have so many patients that have come through, and after the initial induction, yes, there's some work to be done afterwards.
Yeah.
But really, a lot of that is, I think, just getting that initial glimmer of hope. Like,
Yep.
wait, there's another world outside of this dark space I'm in.
Yeah.
Okay, there's something else out there. I'm feeling it, and then that leads to this
Yeah.
positive inertia of like, okay, I'm going to do this step and this step and this step, and you get that positive reinforcement.
Right.
And that's really like why we use the term catalyst for healing. Is
right.
It is a catalyst. It's not the injection, boom, everything's good.
Yeah.
Right. And I think understandably, especially in Western medicine, as physicians and also as patients, we're hardwired to like give me the pill, give me the thing that fixes me.
Yes.
This requires a bit more work on both sides, both as the physician and as the patient. But boy, is it worth it!
Oh,
right, to not have to take something every day because you're broken, right?
Right.
Okay, so one other thing I want to go into is the kind of dosing of these types of things. Like, how often are we taking these medicines? I think it's an important question that I get often is like, do I just do one ketamine infusion and integrate it with therapy, and is that enough?
Yep.
There have been, ketamine's been really studied for mental health purposes for like the last, let's say, about 25-ish years, right?
Which I read, this is a funny story, but wasn't it found because people were coming out of surgery saying their depression was gone, and then they started researching it in like 2000?
Yeah, right around then, late 90s, early 2000. But yes, no, totally. So, I mean, way back when, 1970, ketamine FDA approved as an anesthetic, right? It was basically a really safe anesthetic that can be used, and primarily it was actually used in the battlefield. Like Vietnam War, we had people that were injured in the field, wanted to give them something that can basically dissociate them so they don't feel any of the trauma, pain they're feeling, bring them back to a medical tent, and then fix them, right? Was used in the ER surgeries, still is to this day.
Yeah, so it's very safe.
For 55 years. Late 90s, early aughts, 2000s. It starts to get studied for research purposes. It was initially thought to be like, maybe this can be a mimic of psychosis or schizophrenia, but then all of a sudden people were reporting that they were feeling happy and hopeful, and so then it quickly pivoted to like, maybe this can be used for people that are refractory to other treatment modalities. At the time, really it was like the serotonin and selective serotonin reuptake inhibitors. We'll get into that too in the future. So
we'll get into the complexity.
Yeah, ultimately these studies start to manifest. Ketamine shows use in these treatment-resistant mental health disorders. And then they try and fine-tune kind of the dosing strategy. Is it 1 infusion? Is it 5 infusions? Is it 10 infusions? And it seems like the literature seems to support around a 6 infusion protocol over a 2 to 4 week period. But there's so much
range
there's so much range in the evidence. But there's also, as I learned in this space, you really need to do an individualized approach.
Absolutely.
We start as a recommendation for most people. We say, let's do 6 infusions, but we have patients that sometimes do less, and we have some patients that sometimes do slightly more. You really know after a few infusions if this is something that you are responding to. It's not something that like you get the infusion and everything's good, but usually there's a signal like, I'm feeling something. And we know probably around 3 or 4, is this something that works for me? So kind of that's the beauty of this whole field, is it really is intrinsically personalized. I as much as I hope that there's an evidence that someday that says this is exactly how it should be done, I also don't think that will exist ever.
No, it's not.
There's kind of like there's some beauty in that as well, right? I think we love to have like precise regimens of here's your dosing, here's your strategy, do it. But we're all so different.
We're all so different.
And we come to these experiences.
And that's been helpful, I think, for you and I to work together,
Totally.
because with certain clients, we'll kind of get a sense of what might be a good time to do a booster infusion, which they'll do after a certain point. But again, it's so individualized.
No, it really is. It really is nice too to, I'm not a therapist and I don't pretend to be a therapist, and it's really nice to hear from you recommendations for how we should approach the infusion, because that space is such a sacred space, and any slight way that I say something wrong in that space or something is taken wrong can immediately set the patient off into a spiral. And so little things like, I don't know, an example that comes to mind is when you weigh the patient, don't show them the scale, right? Like that's going to trigger them. Natural human response for a lot of people. But those things go a long way. And I think when you're looking for a space to do this type of treatment, you want a space that's got a real attention to detail,
Yeah.
because everything matters in this.
And I mean, like the nurses you hire, they're all very empathetic and tuned in. I mean, that's the other problem I was finding with some of these other clinics. So the way I did it was through insurance and Spravato, which you don't even get the dissociative piece because they take that out of the Spravato. But it was so clinical, and that's what actually got me into this whole space because it was literally like you walk in and they walk you to a room, they don't even say anything to you, and they leave for 2 hours. You're by yourself. I had to like crawl to the bathroom. There was nobody out there. I mean, it was so bad. And no music, no headphones, which we'll talk about that another episode, makes the entire experience different. And so I was like researching because I was kind of traumatized by the set and setting of that and started bringing my blanket and eye mask and headphones. And so to his point, Justin has set up their clinic that way. You really want to find a clinic that's personable because you need to feel safe and you need to feel secure that these people are going to be there and provide that for you. You guys do that really well.
Yeah, I appreciate that. Yeah, no, I mean, I think maybe a kind of last topic we can touch on is kind of the over medicalization of the psychedelic space.
Yeah.
And I don't say that word lightly. As a physician, like obviously my number one responsibility is to do no harm, right? And so I think we have a natural inclination to do everything in our power to mitigate any risk in this space, but we also have to acknowledge that by mitigating risk, at times we can actually dampen the experience for the patient. And so this is something we'll go into more in detail, I'm sure, but little things can make a huge difference. For example, if a patient's undergoing a psychedelic experience and you intervene to check on them, like, are you okay? Or you have, a blood pressure going off every 5 minutes on the patient, that's, that kind of thing. It's going to take them out of their experience. And are these things truly necessary? And I think there are some things that are absolutely necessary from a medical perspective, but there are some things that I think you can really have an informed conversation with the patient to empower them to make the decision they feel most comfortable with, and come to a kind of a consensus with them, right? It's called informed consent for a reason, and do it together. There are some patients that feel a certain way about it, some patients that want to do it another way. I don't know, what are your thoughts about kind of that over medicalization of this space? Like, what's your experience been with it?
Which part of it?
Like in terms of like when you were at your, let's say, another ketamine space or in the psychedelic space, did you ever feel like it was a traditional doctor's visit where they were like, what's your medical history and what's your surgical history?
Absolutely. Yeah, I mean, it was so, sit you down, take your blood pressure. And then it was so funny because this one nurse would come in after the 2 hours are up and she would say, how was your dissociation? Did you dissociate? And it was like so clinical. And I'm like, I don't feel like telling you because it doesn't even seem like you're interested in my experience. And I mean, anyway, I'll go into that in more detail.
Yeah. Okay.
But yeah, I think let's go over an outline because I know we just wanted to do a brief introduction for our first episode of what do you see as some of the topics we'll address, and then how we hope to kind of flow with each podcast.
So step one, we'll watch this podcast and see all the things we said we were going to talk about, and we'll talk about those.
Yeah.
No, I mean things like the real nuts and bolts of how psychedelics work. I think I love the neurobiology of this, and I think that's only one part of it, but I'm super interested in it because it really gets to like the core of like what is consciousness from a neurobiological standpoint. Like that's such an interesting question. It's so cool that we don't know the answer to that.
Yeah.
Things about the various types of psychedelics, news in the psychedelic space, our experiences working with patients, common questions we get. I think that's enough for multiple episodes.
Yes.
And then hopefully over time, people can reach out to us, can ask us questions, and maybe even specifics about their case, and we can kind of give general thoughts about these things.
Yeah. And we hope to bring in some people to interview.
Yeah, totally.
We know a psychiatrist that works along the lines of is trained in psychedelics and supplements and knows kind of the gamut. So we definitely want to have her come, and then other people share their experiences. So
for sure,
yeah, we're excited. This is going to be fun, and I think mostly our passion is just to get some education out there because we're basically rebranding as street party drug. And people hear the word ketamine, and some are starting to learn and try, but a lot are still very afraid. So we just want to make sure that people really understand all the pros and cons and what what it would be like and be able to answer any questions that people have so that that decision, if you're thinking about it or interested in it, can be easier for you. Because that was one thing when I was looking for research, there was none. I mean, in terms of like, there were no podcasts, there was no anything I could find online to help answer my questions. So we're hoping to get those questions up so that you can understand better when you're making your own decision.
Also, we just like talking about this stuff, so we might as well record it because we talk about it all the time. So that's it. That's the first episode.
Yeah.
We're excited for what's to come, and we'll hope you join with us.
All right. Have a good day.